Are you 7 weeks pregnant and wants to know what's happening in week 7 of your pregnancy? 7 weeks in and your unborn baby is coming on in leaps and bounds. How big is my baby at 7 weeks? Your baby is as big as blueberry. Your baby is continuing to grow at a remarkable pace. Its embryonic form is slowly starting to transform into an actual little person, with emerging arm and leg buds, and a beating heart. How amazing! They also have a tiny tail, but that will soon disappear. Amazingly, your baby has already gone through 3 sets of kidneys by week 7, but this week they'll start developing their final set, which will be ready for waste management. In the coming weeks your baby will start to produce urine, which will form part of the amniotic fluid. Size-wise, your baby is now about 1 centimeter in size and not much bigger than a little bin, bobbing around in your womb. Facts to know about your baby in week 7. Your baby is officially called a fetus, which means offspring, getting nutrition from the yolk sac rather than the placenta for now. Your baby's heart is beating around 160 beats per minute compared to your 6,100 BPM. Your baby starts moving around now. Your baby's hands and feet have webbed fingers and toes. Thumb sucking has been detected in babies from as early as 7 weeks. Your baby's skin is paper thin, almost transparent. 7 weeks pregnant symptoms. Being 7 weeks pregnant can cause a whole range of symptoms. Some are no biggie and some can make it difficult to get through your day. These are a few of the most widespread. Nausea. Morning sickness may be going strong at week 7 of pregnancy. Hang in there, and try to find ways to cope. Some moms-to-be have success with ginger, vitamin B6, and acupressure wristbands easing their tummy troubles. When your hormones become more normal in the 2nd trimester, the nausea should decrease or even disappear. Moms-to-be who are 7 weeks pregnant with twins may be more likely to have nausea and vomiting, since they likely have heightened levels of the hormones that cause morning sickness. Food cravings or aversions. You may find yourself with the urge to eat specific or even weird foods, or not wanting to go anywhere near certain foods you used to think were fine, or even delicious. Food aversions are nature's way of keeping you away from potentially dangerous foods, and typically go hand in hand with morning sickness. It's okay to give in to your cravings and indulge here and there. But try not to go too crazy, and make healthy food choices when you can. Frequent urination. If it seems like you have the urge to pee constantly, it's not your imagination. Even though you probably don't look pregnant yet, your uterus has already doubled in size, and you also have increased blood flow to your pelvis. Acne. Breakouts are due to hormonal changes in your body. Before you use any acne-fighting products, check with your doctor to make sure they're safe during pregnancy. Extra saliva. Here's a symptom you never expected. The excess saliva is probably also hormonally triggered and could be related to nausea too. Mood swings. Not only are your hormones out of whack, but you are probably still getting used to the idea of being pregnant, and that can make you become extra emotional. Cramping and/or spotting. Cramping in early pregnancy is normal. After all, there's a lot happening inside your uterus, and even though it will be several weeks before you feel baby move, you can certainly feel plenty of cramping and pulling at this point in your pregnancy. Also, your cervix may be more sensitive now that you're pregnant, so spotting at 7 weeks could happen. These 2 pregnancy symptoms can be alarming, but know that in most cases, they're not a sign of ectopic pregnancy or other types of miscarriage. If you were to have abdominal pain worse than typical menstrual cramps or bleeding during pregnancy at 7 weeks that's heavier than a period, that would be a cause of worry, and you should call your doctor right away.